How's it going, YouTube? So, about a month and a half ago, I had septoplasty and turbinate reduction. So I figured I'd make a video much like my cervical disc replacement videos and kind of give you a rundown on what I was going through prior to surgery, and then all of the things I had to go through post-surgery. Now, post-surgery, I was in no condition whatsoever to be making videos, but I do have some photos of myself and kind of what I went through post-surgery. So prior to having the surgery, I had my nose broken several times, and this had deviated my septum, and I had a big knot right here. I still have a little bit of a knot, but I had a fairly large knot in my nose. My right nostril I could barely breathe out of, and when my left nostril would get stuffed up, I couldn't breathe through my nose at all. This made it difficult to sleep. Sometimes I would wake up in the middle of the night gasping for air. I would snore quite frequently, and it was becoming an issue in my life, especially as I get older. So I decided that I should probably get it taken care of. Now, I went in to get the septoplasty and turbinate reduction, and it was a one-day operation. It was in and out the same day. Of course, I needed someone to give me a ride back. So, day of surgery, I come out of surgery, and I was supposed to be under general anesthesia for about 1.5 hours. I'm not sure what happened exactly, but the doctor said I ended up having to be under for an additional hour. But one of the things that he did say is that my bone was extremely dense, very hard, and it was difficult to break. So they had to re-break the bone right here, right at the top of the bridge. They made an incision up here, and I had a little stitch after surgery. They made an incision actually inside my left nostril and cut up inside and did the septoplasty from inside the nose. Immediately after surgery, when I woke up, I had a pounding headache, which I suppose is to be expected when they take a chisel and hammer and break your nose. So expect to not be feeling really good immediately after surgery. Even on the pain medication that they put me on, the headache was still there pretty bad. And I'll go ahead and start taking you through these photos. As you can see here, this is probably about an hour post-surgery. They were still keeping me in the hospital just for a little while to see how I was reacting to the anesthesia. I certainly was not in a pleasant mood. They had gauze underneath my nose to catch the blood that was pretty much constantly flowing. Inside my nose, they had 2 splints in each nostril, one in each nostril, and they have a little hole in the splint to allow you to breathe. But further along, as I progressed the day after and so on, as my face began to swell and my sinuses began to swell, it became more and more difficult to breathe. In fact, most of the time I couldn't even breathe through my nose. Throughout that first week, I was continuously breathing through my mouth, which made it difficult and very complicated when I was sleeping. So after surgery, you're not going to be able to lay down flat and sleep. You'll likely need to either have a reclining chair or prop some pillows up on a couch and sleep elevated slightly. Additionally, I recommend having a glass of water and a straw close by. As you can see in these photos, you will have gauze right underneath your mouth, or right underneath your nose, over top of your mouth pretty much throughout the first 3-4 days at least, to catch the blood that constantly runs, especially while you sleep. So you'll need a straw because you're not going to be able to tilt cup back. Additionally, your upper lip and your palate, your upper part of your mouth, is going to be pretty deadened, pretty numb. Maybe feel a little bit of pain, but for the most part, it's going to be deadened. It does hurt. I'm not going to tell you it doesn't. But the pain isn't that bad. What really makes you suffer is the swelling. As you can see, I'm just beginning to swell up in these photos. You can see a little bit of swelling around my eyebrows, at the top bridge of my nose. My nose is obviously very swollen. My cheeks are beginning to swell a little bit. But the forehead, the sinuses, that swelling, that becomes a serious issue, becomes a real problem. You're going to want to flush your sinuses out with a saline nasal flush, nasal spray at least, just to help relieve some of the pressure. My ears felt like my eardrums were going to burst. That's the kind of pressure I was feeling in my head. My nose at the bridge and behind my sinuses, around my sinuses, it was just like a throbbing pressure. At this point, I was able to have the gauze off for a little while, but I was continuously having to either put it back on or dab my nose and catch the blood that would always run out. You will have some stitches on the inside of your nostril. They will likely dangle out a little bit, and it's going to look gross. It's going to look like you have hairs hanging out of your nose, but it's just something you'll have to put up with. As you can see here, the swelling has probably reached about its peak. My forehead, the bridge of my nose, my eyebrows, my eyes, under my eyes, cheeks, all swollen. Even my lips were swollen a little bit. Throughout this time, you're still going to want to have a lot of water. You're going to drink a lot of water, stay hydrated, and you're likely going to want to still use straws to drink. While you sleep, you're going to be sleeping with your mouth open a lot because you can't breathe through your nose. So your throat will get extremely dry, your mouth will get extremely dry. You may wake up kind of gasping, unable to really breathe or anything, and you're going to need that water handy post-surgery for at least the first week, just to continuously drink and hydrate. And you're going to wake up probably 4 or 5 times throughout the night to drink water and get up and use the restroom. About 4 or 5 days after surgery, your eyes will be extremely swollen. You'll have a lot of blood build up in there. You'll have the 2 black puffy eyes, but a lot of the swelling in your sinuses will go down. It'll become easier for you to function. It won't be throbbing behind your nose and your sinuses. Your ears will likely be fine. As you heal a little bit more, after the first week is usually when they'll take the splints out of your nose and take this white splint off the top of your nose. And I tell you what, that is an incredible feeling, getting those splints out of your nose and finally being able to breathe through your nose. It's wonderful. I got teased a lot by my coworkers. They called me Trash Panda for my 2 black eyes. One of the things that did concern me, other than obviously whether or not my nose was going to be straight, whether it was going to look normal, whether the swelling was going to go down, other than those obvious things, my cheeks, actually, if you look in this photo, you can see both sides of my face are kind of droopy, and I was wondering if maybe they had hit a nerve, deadened that part of my face, and it was just going to hang like that permanently. So I was a little concerned about that, but actually my face has gone back to normal. This is what my nose looked like while I was at the hospital prior to surgery. You can see I have a little bit more of a bump. That's part of the turbinate reduction that they were going to work on. You can't really show the deviated septum unless I shoved a camera up my nose, and I didn't want to do that. So this is post-surgery after I was able to get the splints off. My nose had gone down a little bit, the swelling had gone down. And then this is the last photo of me post-surgery with my nose, and I think it's gotten a little bit better. I still do have a little bit of swelling along the sides of my nose here where the knot usually is. I have a little bit of a bump left, but I wasn't going in for cosmetic surgery. I went in for functionality. Now, that being said, it sucks. I'm not going to lie to you, it sucks. It's painful. You'll have a headache for probably the first 2-3 days. You'll have a lot of pressure. That's probably the biggest issue, is the pressure, other than the issue with sleeping and constantly waking up with dry throat, dry mouth, not being able to breathe right. It's first week of this post-surgery really sucks. After the first week, once you get those splints taken out, get the splint taken off your nose, it gets a lot better from there. But that first week is going to be the rough patch. That's going to be the hard one to get through. Once you can get past that first week, it's all downhill from there. So, with that being said, if you have issues like I did prior to surgery, not able to breathe right, have issues with snoring, especially if you're getting older, have issues with waking up in the middle of the night, gasping for air, anything like that, this might be right for you. If you just don't like the fact that your nose is a little bit crooked, or you just don't like the shape of your nose, just be forewarned. This is not a surgery to be taken lightly. I had cervical disc replacement surgery, and it was far less tedious, far less of an issue post-surgery than the septoplasty and turbinate reduction. So if you want to do this surgery for cosmetic reasons, just be prepared for what you're going to be dealing with afterward. Other than that, if you have any questions, or you'd like to know a little bit more about what signs, symptoms that I had prior to surgery and after surgery, and what I went through, just please leave your questions in the comments section below. I'll try to check as often as possible, and I'll get back to you as soon as I can. Check out my other videos with my cervical disc replacement, especially if you're looking at having any kind of surgery done on your spine, or have any neck issues. That could be something that might help you out in the future. But hopefully you get something from this video, and if you did, please hit like and maybe subscribe, and I'll have other videos that maybe help you in the future.